So this is not at all the video I intended to do today, but I had an awesome conversation with a new patient this morning as we were going over her 3D CAT scan imaging, just showing her what's going on. We take 3D imaging on most of our patients. I was just pointing out some degeneration, for lack of a better word, some wear and tear in her spine. And she asked me, "Now, is that arthritis? Do I have arthritis?" And I paused for a split second and finally said, any medical doctor who looked at these pictures would say this is arthritis, but it's not. Any medical researcher, any chiropractor will tell you this is actually a different process called arthrosis. And I wanted to explain this difference with her. She was excited and happy to hear about this. Now, these are $10 words. In the previous video, I talked about how I do not like these labels. They are not diseases. They are not entities out there to get you that we have. They are just descriptions. But for the sake of convenience right here, we're going to just unpack them and use them as we normally would. So arthrosis, what is that? That's what she had going on. This is what most people have when they're told by a doctor that they have arthritis. And it's just the degeneration, the breakdown from long-term wear and tear, usually from ignored past injuries where they didn't see a chiropractor, or just life and the stresses of life, whether that's obesity, a difficult job, paratroopers, some of my favorite people to get as patients, ex-military. And you can see that. You can see the breakdown, and you can also see the intelligent adaptations that the bone makes, because bone can change. Bone responds to the stresses that it's receiving. So not a disease, just a collection of descriptions of what's going on in this situation. But what is arthritis then? So there are people to whom this label applies. They are a very small minority of the people who are told they have arthritis. These are folks who have been told they have rheumatoid arthritis, psoriatic arthritis, and so forth. Very small minority of people. And arthritis just means inflammation of the joint. That arthro means of the joint, and then the itis is the inflammation, specifically of the synovium of the joint. That's not important. Very small group of people. But these are treated entirely differently, because osteoarthrosis, the thing that most people have, is not an inflammatory process at all. There may be some secondary mild inflammation there, but that is not the main part of the clinical picture going on there. So they need to be dealt with very differently. When people hear arthritis, and even when medical doctors see a diagnosis of arthritis, it's treated very differently oftentimes than it should be. Rather than corrective care through chiropractic care, which is essential, or working on decompressing the load that those joints are under, strengthening the surrounding tissues. Instead, there's a focus on chemical management, with injections, with anti-inflammatory medication, which is really not at all the answer to these things. Honestly, even if it was really truly arthritis, but definitely not in these cases where it's this degeneration. It's not the right approach. So even worse than this, there is a huge body of research now that is showing that the overwhelming majority of people have and develop this kind of degenerative change over time. And of them, the overwhelming majority have no aches, pains, and symptoms. The most common thing that I am told by a patient about this is early on, first visit, usually they say, well, doc, I have arthritis, but I know there's nothing that you can do about that. Now, there's a few things to unpack in that statement. Number one, I have arthritis. Well, already we probably know they don't, okay? But that aside, but I know there's nothing you can do about that. There's two things there, really. The first is the obvious thing, nothing we can do about that. Well, in a certain sense, that's true. I think of it like, these old manuscript books on display at a museum. They're hundreds and hundreds and hundreds of years old, some of them over 1,000 years old. And there's tons of wear and tear in these books. They were used, and they're old, and they're on display now. And no, you can't maybe undo some of that damage, but you can do a lot of restoration to that book. You can do a lot of things to improve the quality of the book, and you can certainly preserve it to ensure that it doesn't degenerate further. So there is really a lot that we can do about that. But what that person's really saying is, I know that I have to live with that. I know that what I'm feeling is partly or entirely due to this thing, arthritis, that this doctor told me that I have. And so I know there's nothing you can do about that. I have to live with that pain and with those symptoms. And that is just such nonsense. That is such nonsense. It is very atypical, again, that arthritis, that arthrosis process going on is the source of that individual person's pain, which is why people in pain have so much success coming here. There is something you can do about that. Your body can start healing and working on that. But it is a part of this bigger problem that has really been at the core my message in these videos, which is how shackled we are by the medical way of thinking. It's gotten us into such a bad place, the sickest developed nation in the world, because we have this way of thinking and addressing these problems. It's not true. We have the autonomy. We have the individual strength and fortitude to make decisions and changes about our health, and it can be changed. It's not to be living at the end of a prescription pad for the rest of your life. So I got so worked up this morning talking with this woman. She was getting excited about what we were talking about. And no, if you've been told you have arthritis, and you'll know if you have real arthritis, because I mean, you're going to be on heavy medication usually. It's really a significant problem, which also there are other ways to get help for other than the medical world. That's a whole other video. But more than likely, you have this osteoarthrosis, which goes by many names: degenerative disc disease, degenerative joint disease, osteoarthritis. Those are all just that arthrosis process going on, that wear and tear. There's so much that can be done about that. There's so much that doesn't need to be done about that. So hopefully this was interesting to you, resonates with you, especially this backwards approach that we're looking at things from the medical model that all of us, myself included, are just indoctrinated with from the time that we're born. So please like this video, share it with people. More importantly, get this word out there and subscribe to our channel. There's lots more of this coming. We'll be talking to you soon.